can patients undergoing cancer treatment ensure they are meeting their protein needs when facing taste changes or digestive issues? Are there certain meats or protein drinks that should be avoided altogether? I'm getting some clear answers from a respected expert in this Patient Empowerment Network Restore program. Julie, what are some practical tips for those of us actively undergoing treatment when it comes to protein needs? And can you share some of the best practices that have been successful, particularly for those of us who have experienced taste changes or digestive issues?
Yeah, so protein needs can be challenging to meet because a lot of our favorite sort of comfort foods that we usually go to when we're sick are not necessarily high in protein. So the first thing to, I think, do is to kind of speak with your medical team to see how much protein you might be needing, or if you think you're having enough. They can usually do a simple calculation, or you yourself can actually calculate if and we do this in kilograms for whatever reason. Us dietitians work in kilograms. So if you take your body weight and divide it by 2.2, that will get your kilograms. And then generally, we would say for people during treatment, aiming for 1 to 1.5 grams of protein per kilogram body weight is something that I think can give an easy range. The typical person, we would actually put more at 0.8 grams per kilogram body weight. But because when people are under treatment or have active treatment going on that often uses more of our stores, then we sort of bump that suggested range up a little bit. So once you kind of have an idea what that is, then you need to know, well, what are the foods that I'm eating that have protein? So you mentioned meats, you mentioned some protein drinks. So those are pretty easy ways to get quick protein. There are plant proteins as well, nuts, seeds, and beans. But when you're talking about digestive issues, sometimes those higher fiber forms of protein are not the easiest to digest. And I know a lot of treatments do cause people digestive issues where they are just not able to sort of break down some of those more complicated foods. So meats and protein drinks tend to be the easiest to digest, as well as, the dairy-based protein, which you can find in milk, yogurt, cheese. Those are ways, as long as you tolerate lactose in the milk. But even if you don't tolerate lactose, it's pretty easy to get lactose-free options. Milk is a really simple thing to throw in smoothies that helps to add more. Um, and I think any types of meat are fine as long as you tolerate them and they, taste good to you. Some of the ones that are just easier to eat will be some of the softer meats, things you don't have to chew as much. So more like chicken or like shredded meats or anything that might be in a soup where it kind of just goes down with the liquid. Protein drinks are great. I would pay attention to how much protein you can get per, usually they're in 8-ounce containers. So finding like the plus version, so things like Boost Plus or Ensure Plus will have higher levels of calories and higher levels of protein. So per 8 ounces, you get better bang for your buck. And then you can make your own sort of protein drinks at home, like I mentioned, using milk, or you can buy protein powders that eat. Actually, most affordable protein powder you could get would be like a dry milk powder that you can just toss in with extra things. So I think those are really simple, easy ways. But the most important thing is that you make sure you're eating regularly and you're including protein regularly throughout the day. So if you're not eating much, then having something every 2 to 3 hours, like with an alarm, and making sure that when you have something, it does include protein. It's much easier to meet your needs when you're doing that several times a day than if you're relying on like 1 or 2 sort of eating sessions a day to get them all in.
Okay, thank you. Julie, how can patients safely incorporate protein powders or shakes into our diet without disrupting treatment? And is there any risk of getting too much protein?
Well, you can get too much protein. I don't see that very often unless somebody is using a ton of those protein powders, which I just don't really find feasible for people who are having, digestive challenges or appetite issues. So it seems unlikely. I would be cautious with protein powders that you get from like a health food store. because they're not regulated in the same way that food is regulated, I wouldn't take that risk if it were me or my family member. If I were going to use a protein powder, I would purchase one, either from the grocery store, like the dry milk powder is regulated and controlled in terms of there's not going to be contamination. The other challenge with some of the protein powders at the health food stores is that they're typically not designed for the sort of, typical oncology patient. They're really more designed for people who want to be like bodybuilders. And so they'll throw in lots of this other stuff, creatine or different things that they claim are, boosting performance that I wouldn't be comfortable throwing into the mix of my oncology treatment, regimen. So I tend to be pretty basic. I just, if I want protein, I want to include things that only have protein. I don't want a lot of extra other stuff. If I'm going to add fiber to my day and I need to use a fiber supplement, I actually don't want any extra stuff. And I don't want the flavorings with it. I just want it plain. And so I feel that way about protein as well. Ideally, you will get it from food sources. If you can't meet your need from food sources, protein powders from like legitimate sort of food-based sources, even if they are, in shake form at the grocery store, sold on the shelf, they should be pretty well, checked and monitored. And so that's what I tend to tell people to look for when they're trying to make sure to get enough protein.
Okay, that's great information for patients. You heard it here directly from our expert. Thanks for joining this Restore program. I'm your host, Lisa Hatfield.